SARS-CoV-2 was first identified in Wuhan, China in December 2019 and quickly spread globally. Thailand reported the first case outside China, and Malaysia confirmed its first 3 cases on January 25, 2020. On March 12, 2020, the World Health Organization (WHO) declared COVID-19 a global pandemic. With no cure or vaccine initially available, the virus spread rapidly through close contact. In response, WHO released the COVID-19 Strategic Preparedness and Response Plan (SPRP) in February 2020, urging countries to align their national plans by April 30, 2020. Malaysia's Ministry of Health (MOH) took early preventive actions and was rated at the highest readiness level, Level 5, on March 16 and May 11, 2020. This review aims to evaluate Malaysia's COVID-19 response to improve future preparedness and share valuable lessons globally.
Now I will explain how the Ministry of Health (MOH) planned their response during the COVID-19 outbreak. Firstly, MOH activated the Crisis Preparedness and Response Center to coordinate the national response and conduct yearly risk assessment. They also created standard procedure for detecting cases, isolating patients, and conducting tests and quarantine. In terms of resources, MOH ensured enough medical supplies and opened dedicated hospital to treat COVID-19 patients. Temporary treatment centers like PKRC were set up for mild cases so that hospital could focus on serious patients. The planning followed 3 main phases, starting with containment, then mitigation, and finally preparing for reopening and vaccination. MOH keep the public informed through daily updates and media campaign about health measures like hand hygiene and social distancing. They carefully plan the vaccine rollout, starting with frontliners, then high-risk groups, and finally the general public. Lastly, MOH worked with other government agencies, NGOs, WHO, and from the CITF.
3.0, the managing the issue organizing. So first thing first, we have quick actions and coordination. So fast response by MOH, the Ministry of Health act quickly to manage the COVID-19 outbreak in Malaysia. Then setting up CPRC, the Crisis Preparedness and Response Center, was great to coordinate hospital, clinic, and state health department. Next, clear SOP for everyone. Healthcare workers follow standard steps for testing, isolation, and treatment to avoid confusion. Lastly, organize to use hospital space. So COVID-19 patients were placed in single room if possible, or grouped with safety rules like distancing and ventilation. The second point is smart resource and safety planning. So PPE distribution based on race. Masks and suits were given according to how much risk workers face to keep them protected. And well-planned operation. MOH plan cleaning, patient transports, and staff training in detail. Department guideline. Clear instructions were given to all units, including radiology and dialysis. Next, protecting healthcare workers. Strong planning help reduce infection among staff and use resources wisely. And the last point is technology and communication strategy. First, using My Suggester app. The app helped people report symptoms and gave real-time updates on COVID-19 cases. Mobile team and target testing. MOH sent health teams to high-risk areas and expand testing to control spread. And next, centralized information sharing. CPRC shared data quickly to support fast and accurate decision making. And lastly, public-private sector collaboration. MOH worked with private hospitals to share beds, PPE, and staff to handle the crisis together.
So,
we will proceed with 4.0, managing the issue, which is decision making. There were 4 decision making that our country made in COVID-19 era. So I will go through one by one. The first decision making is adaptive and evidence based on strategy, which is policy adjust based on real-time data. And then strict lockdown during spike, which is relaxed measures during low infections and then periods. So National Recovery Plan, which is NRP, guide decision using key indicators. They have 3 indicators, which is new infection rates, ICU bed usage, and then vaccination rates. So the second one is actually digital tool. So digital tool that we use in COVID era is MySejahtera apps. So MySejahtera app launched in April 2020 by MOH, NCS, and Mampu. So the Central to Malaysia Digital Health Strategy, and then they have a lot of key function, which is health self-assessment and then contact tracking. Another one is vaccination registration and certification, COVID status and test result, and lastly is hotspot tracking and history check-in, which is MySejahtera is literally a best working digital tool in COVID era that help people to adjust with the environment and then know where is the high risk place and low risk place in COVID era. The third one is impact of MySejahtera. Impact of MySejahtera is enable efficient real-time data collection and then supported localized lockdown via hotspot detection. MySejahtera also boosts SOP complaints through daily use features. And lastly, it received global prize from WHO for speed and then effectiveness. And the last point is public participation and interagency cooperation. So in this point, our regular government update and public engage, which is collaborate with public sector for what? So vaccine can roll out, and then we have financial aid, and lastly we have healthcare support, which is private hospital handling and serve case from COVID-19. We can't only use government sector to help in this kind of pandemic, which is it's so hard and so big. So we need our private sector to help and then engage with people in public also. Our government did great job to pull this out, and then to make sure that our country is in good condition. And
this can make early preparation for hospital and clinic staff when COVID-19 cases increase, and centralized resource distribution and resources distribution also taken into account to ensure that hospital receive needs based on the severity of the outbreak. Meanwhile, the early warning system and regional control are taken into account, namely the MHO introducing a red zone, yellow zone, and green zone to control movement and monitor the level of transmission according to area.
This can make it easier for every citizen and government agency to know current issue and be more carefully when outside the home. In the meantime, cross-district and state control is implemented based on current case data controlled by the MHO, which can reduce cases from spreading from the break to outside and spreading more severe to the green zone. Lastly, similarly, media monitoring and false information are taken seriously during the COVID-19 issues by establishing a health crisis communication unit to monitor the spread of fake news and ensure that only authentic information is disseminated. This is because when information affects when fake news are spread, it can have a negative impact on the individual because it can be stressful for individuals. Finally, dynamic policy research and evaluation is carried out, namely MHO, MOH is consistently evaluating the effectiveness of policy through data and studies, for example, changing the strategy from full MCO to a targeting approach and re-evaluating the use of medicine or treatment method based on the latest clinical data and local study results. Thank you.
In conclusion, the Ministry of Health (MOH) Malaysia demonstrated a comprehensive and effective management approach in dealing with the COVID-19 pandemic through strategic planning, robust organisation coordination, informed decision making, and consistent control measures. MOH was able to lead the nation through one of the most challenging health crises in recent history. Key strategy is such as activating the Crisis Preparedness and Response Center, implementing the Movement Controls Order, utilizing digital tools like MySejahtera, and ensuring interagency collaboration were crucial in managing the spread of the virus and maintaining healthcare service. The government's ability to adapt policies based on real-time data and evolving circumstances, coupled with transparent communication and public engagement, helped build trust and compliance among citizens. Overall, Malaysia's COVID-19 response highlighted the importance of preparedness, leadership, coordination, and data-driven policy in managing public health emergencies. Organizationally, the MOH effectively mobilized healthcare workers, established designed facilities such as a quarantine center and COVID-19 hospital, and ensure the safe distribution of essential supplies such as personal protective equipment. Decision-making process were groundedly in scientific evidence and supported by interagency cooperation. With the National Security Council, which facilitates consistent enforcement of public health policies such as a movement control order, controlling measures such as a real-time health audit, the use of the MySejahtera apps, monitoring of compliance with SOP, and transparent public communication contribute significantly to slowing the spread of the virus. Moreover, the government's flexibility in adjusting policies such as transitioning from total lockdown to targeted measures demonstrated adaptability and resilience. Ultimately, Malaysia's response to the COVID-19 pandemic showcased how effectively planning, coordination, decision-making, and control can lead to successful crisis management. The Ministry of Health leadership, combined with public cooperation and support from various sectors, not only helped protect the nation's healthcare system but also laid the groundwork for recovery.
This experience served as a valuable model for handling future public health emergencies with preparedness, unity, and determination.